Thank you very much for your inquiry about SculpSure. SculpSure is really a breakthrough in fat reduction, and what's so fantastic about SculpSure is that you can do it in 25 minutes in the comfort of the office. I actually did my love handles and I went right back to the gym. So you're probably wondering, how does it work? There's 4 paddles. This is one of the paddles, and what they are is they're secured on any part of your body from the neck down with a little strap, and it's held quite firmly. It actually has 2 aspects. There's a laser beam that comes out through there, and there's a cooling plate. So what happens, it gets secured. So if I was doing my upper abdomen, the plate's secured there and it's sending heat through the skin and melting the fat. The science behind it is fat has a very poor blood supply, and if you heat fat to 47 degrees, you'll kill it. And that's how it works. What's great is the laser can go through all skin types. You can be black, white, or any color in between, and it won't hurt the skin. It heats the fat up, and then it breaks and kills the fat, and then your body just breaks it down over a course of several days to several weeks, and you just basically pee it out. So there's nothing dangerous about it. There's no bruising. It definitely gets warm, but it's very, very tolerable. There's a TV set in this room. You can play on your iPhone while it happens. And as I said, right afterwards I went to the gym. I had no discomfort whatsoever afterwards. Some patients say they're a little bit tender, but it's certainly very tolerable. Almost everybody's going to want a second treatment 6 weeks later, and then they'll continue to improve for 3 months. Somebody that's super skinny may get away with 1 treatment. Somebody that's a little thicker or a lot thicker may want 3 or 4 treatments, but a good average is 2 treatments. And as I said, it's 25 minutes, so you can literally do this on your lunch break. You're probably wondering, how much improvement can I get? And what the company studies have shown is most patients will have a reduction of about 24% fat in the area. So it's important to understand you're not going to be perfect. Each subsequent treatment will improve you, but it's not realistic to expect 24%, or everybody could do 4 treatments, lose almost 100% of their fat, and we'd all look like the cover of Men's Fitness magazine, and that's just not going to happen, but it definitely can help. What I tell all of my patients is there's no magic. This is a great tool, it's helpful, but if you want to look your very best, you of course want to exercise more, be more strict with your diet, and help us help you. But even if you don't do that, you're still going to get a nice improvement. Where can this be placed? Essentially anywhere. What are the common areas? Upper arms, obviously upper and lower abdomen, lateral chest wall, bra fat line, back fat, lower abdomen, thighs, knee area. If there's fat, we can treat it, and quite safely. The only area that really can't respond is sometimes people will have fat that's behind their abdominal muscle, and that can't go through the muscle. It's extremely safe, so you don't have to worry about your organs underneath, and as I said, it's only a 25-minute treatment. I would encourage you to come in. We can talk about SculpSure, we can talk about other modalities. We have like Smart Lipo to address your concerns. Each one has different strengths and weaknesses, and we'll be more than happy to explain that when I see you in consult.